Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, my name is Nur Adila binti Ibrahim. I'm from Bachelor of Medical and Health Sciences from OUM Petaling Jaya. Today, I would like to share with you guys about one of the most common mental illness in Malaysia, which is schizophrenia. Okay, first of all, what is schizophrenia? Schizophrenia is a term used to describe a major psychiatric disorder that alters an individual's perceptions, thought, affect, and behavior. Schizophrenia is a complex, chronic mental health disorder characterized by an array of symptoms including delusion, hallucination, disorganized speech or behavior, and impaired cognitive ability. Schizophrenia is a chronic and severe mental disorder affecting more than 21 million people worldwide, which is characterized by distortion in thinking, perfection, emotion, language, sense of self, and behavior. Malaysia developed its National Mental Health Registry for Schizophrenia in 2003, and 7,351 cases had been registered from 2003 to 2005. Even though the first General Hospital Psychiatric Department was opened in Penang General Hospital in 1959, it was only in the 1990s when decentralization of mental health service really took off, when more units in General Hospital being opened all over Malaysia. Okay. Risk factor for schizophrenia. First is prenatal and perinatal event, which is complication in the fetal life and born in the late winter, early spring, increase the risk for patient to get schizophrenia. Second is paternal age. Older fathering increase risk for the child. Urban environment, more common in disadvantaged area, especially in the less support area. And fourth is drug abuse, persistent abuse of amphetamine, methamphetamine, and cocaine. Cannabis increased rates of psychotic episode. And lastly is social adversity. For example, physical abuse, sex abuse, maltreatment, and bullying. Okay, now I would like to share with you about one of the case I've got during my posting for mental health in Penang General Hospital. There is a 55 years old Kelantanese born woman who graduated from an Asian university and received gold medal in mathematics. She was admitted to psychiatric ward with a diagnosis of paranoid schizophrenia for 30 years. She was diagnosed as paranoid schizophrenia at the age of 25, which was precipitated by a broken relationship with her tutor. Over the years, she has been treated and stabilized with intramuscular flufentisol. This case illustrates on how a patient with high academic background developed delusion based on her life experience. It also shows the influence of intelligence on sophistication of her delusion. This patient expressed her feeling through writing, and it helps psychiatrists to diagnose her illness. Okay. Patient details. Patient was female, 55 years old, Malay, Islam, single, worked as a private tuition teacher, admission form 3 and 4. Chief complaint, patient talking by herself, locked in her room for days. History of present illness, patient had been diagnosed with schizophrenia for 30 years ago. Relapse at least 2 times per year. No known medical illness. History, family history. Mother had BMD, bipolar mood disorder. Father died a few years ago due to depression. No surgical history. Patient able to work because she worked as a tuition teacher, private tuition teacher. Okay, physical examination on general, patient look good, no scars, no abnormality. Patient temperature afebrile, pulse rate normal, respiratory rate normal, blood pressure also normal. All the vital signs normal. For the cardiovascular system, on auscultation, there was dual rhythm normal. For the respiratory system, lungs clear, normal breathing, abdomen no tenderness, no pain. Central nervous system, normal muscle reflex, no tremor. Nerve stimulation, we do the knee jerk and plantar reflex, also normal. Okay, for mental health history and assessment, on the interview we look for patient's habit, sleep pattern, and appetite. It was good and normal. For the general appearance and behavior, general impression, patient looks sad. State of consciousness, patient conscious. Physical appearance, patients look good. Manner of dressing or cleanliness, good. Facial expression and posture also good. Patient was good in manners and able to cooperate during the interview. For talk, language and dialect spoken, patient talk in Malay and English. Amount of talk, patient prefer in writing. For rational and relevance, respond to question and relevant answer given. Flight of ideas present, thought block sometimes. Pressure of speech, slow voice. Word salad, patient use English and Malay. Mostly patient use English in writing. Okay, for mood, mood state, patient instability. Sometimes patients look okay, sometimes look sad. Affective response, alert. Consistency of mood, suddenly elated, suddenly sad. No withdrawal symptom. Thought content, delusion and misinterpretation present. Feeling of influence present. Feeling of passivity not. Hallucination present. Obsession and phobias also present. Overdetermined ideas not in list. Suicidal thought is present. Okay, for orientation, for place, patient know she is in hospital. For time, patient know what time when she was interviewed, and patient knew who was interviewed her. Okay, for memory, patient mostly able to recall his past and able to know where to get the glass to drink water. Immediate memory, patient able to answer question. 5-minute memory test, patient also can remember what we already asked her. Information and vocabulary, estimate intelligence level, patient was highly educated. Abstraction for proverb test, answer clearly. Attention and concentration, distractibility sometimes. But for the serious 7 test, patient very cooperative. Judgment, good and rational. Insight, patient was good and rational. Okay. There were stages in schizophrenia. There are 4 stages in schizophrenia. Okay, first is risk or premorbid. For features is genetic and environmental risk. Second is asymptomatic. Okay, for the second stage is prodrome. Its feature was cognitive and social deficit and help seeking. Third phase was acute psychosis. Its features is relapse and remitting. Patient have suicidal risk. And for the last stage is the fourth stage is this chronic psychosis or residual. It was medical complication and disability for the last stage of schizophrenia lah. Okay, for management of schizophrenia. Actually, schizophrenia needs long life management even though the symptoms have decreased. Treatment with medication and psychosocial therapy can help manage the condition. There are 2 types of management can be done toward schizophrenia patients, which are, first is pharmacological treatment, second is non-pharmacological treatment. Okay, for pharmacological treatment, we have 3. first generation antipsychotic, second generation antipsychotic, and long-acting injectable antipsychotic. Okay, for first generation antipsychotic, we give example of first generation antipsychotic included haloperidol. Haloperidol is the first generation antipsychotic, have frequent and potentially significant neurological side effects, including the possibility of developing a movement disorder, or we call tardive dyskinesia, that may or may not be reversible. That was the example for the first generation antipsychotic that we always use, which is haloperidol. Okay, for the second generation antipsychotic, these newer second generation medication are generally preferred because they pose a lower risk of serious side effect than the first generation antipsychotic. Second generation antipsychotic include risperidone, olanzapine, not first-line drugs, and clozapine, also not first-line drugs. Okay, for long-acting injectable antipsychotic, there were antipsychotic that may be given as an intramuscular or subcutaneous injection. They are usually given every 2 to 4 weeks depending on the medication and severity. Some of the drugs that are given by injection are first, haloperidol decanoate, risperidone, or we call risperidol consta or Perseris, and third is flufenazine decanoate. Okay, that's for pharmacological. Now we go to the non-pharmacological management. First is family therapy. We do family therapy for, especially for common at the risk group patient, provide knowledge and support to families how to deal with schizophrenia patient. For the second is regular review. Psychotherapy may help to normalize thought pattern and learning to cope with stress and identify early warning signs of relapse. Can help people with schizophrenia to manage their illness. Third is motivational interviewing and social skill training. We focus on improving communication and social interactions, plus improving the ability to participate in daily activities. And last is electroconvulsive therapy or ECT. We can do ECT for schizophrenia patients, but for adults with schizophrenia who do not respond to drugs therapy, ECT may be considered because it's helpful for someone who also has depression. Okay, how to identify the diagnosis of schizophrenia and intervention for the patient. The DMS-5 states that the diagnostic criteria for schizophrenia included the persistence of 2 or more of the following active phase symptoms like delusion, hallucination, disorganized speech, grossly disorganized or catatonic behavior, and the negative symptom. At least 2 of the active symptoms plus the passive symptom. Each of these symptoms must lasting at least for a month. The symptoms of schizophrenia usually begin late adolescence and the mid-30s. Okay, some of the symptoms are, okay, for the active symptom, we have hallucination, delusions, disorganized thoughts and speech, disorganized behavior. For the passive symptom, we have apathy, self-neglect, blunted mood, decreased motivation, and withdrawal. So to diagnose a person with a schizophrenia, at least 2 or more of the active symptom plus the passive symptom, and it must last for at least 1 month. Okay, to warrant a diagnosis of schizophrenia, the patient must also exhibit a decreased level of functioning regarding work, interpersonal relationship, and self-care. They must also followed by persistent signs and symptoms of the schizophrenia for at least 6 months, including the first month of the active period phase symptom as noted above. A detailed differential diagnosis of schizophrenia is necessary in order to distinguish the disorder from other mental conditions so that the right intervention can be done toward the schizophrenia patients. Okay, for the conclusion, schizophrenia is a complex disorder that requires prompt treatment at the first sign of a psychotic episode. Even though patients can increase adaptive functioning through available pharmacological and non-pharmacological treatment options, it hoped that the future research will address gaps in treatment and potentially a cure for schizophrenia. There was no confirmed way to avoid or prevent schizophrenia. However, sticking with the treatment plan can help prevent relapse or worsening of the symptom. With appropriate treatment and support from others, most schizophrenia patients can manage their illness very well and start their new life by themselves. Okay, here I would like to share with you some quotes from John Green. There is hope, even when your brain tells you there isn't. Okay, that's all from me. Thank you.